All right, so the next test is another shear test, but instead of for the lateral epicondyle, it's for the medial epicondyle. And this is actually called Medial Epicondylitis Test 1. We'll also have a video on test number 2. And so they don't have the fancy physician names as the lateral epicondylitis tests do, but it's similar in that there's an active or resisted or a shearing test, as well as a passive extended tissue stretch test. So if you think about those two principles, you'll be able to remember the two tests for each side of the forearm. So if someone comes in complaining of medial epicondyle area pain, you want to distinguish if it's one, a UCL type injury, if they have instability to the inside of the elbow ligamentously, or if it's more contractile tissue. And so this test will help you determine that. So you're going to have the patients raise their arm slightly. They're going to be supinated and slightly flexed at the elbow. You're going to have them flex their wrist. And so you're going to start kind of in this little bit of we call it like the arm wrestler's position. You'll palpate the medial epicondyle with one hand, and then you're going to actually try to pull them out of this position. So you're trying to pull them into wrist extension and elbow extension. And we're going to try to shear the tissues that attach onto the medial epicondyle. So you palpate there. Don't let me move you is my cue, and then we pull and resist. And if they start to have discomfort at the inside of the elbow, it may be indicative of medial epicondylalgia.